Amniotic tissue-derived allografts are a breakthrough tool for physicians who treat diabetic ulcers and slow-to-heal wounds, mitigating amputations. In the U.S. alone, approximately 6.5 million patients are affected by chronic wounds. This is fueled by the aging population, obesity, and diabetes. These resistant wounds add significantly to the healthcare bill, with estimates of over $25 billion spent annually to treat chronic wounds, and even more if we include amputations. Allografts use amniotic tissue that's derived for homologous use, meaning tissue matching is not required. The tissue is a rich source of bioactive factors involved in wound healing and have anti-inflammatory, antibacterial, antifibrotic, and re-epithelialization properties. It's rich in active biologic components that include growth factors, cytokines, proteins, and other cellular components. When applied to a wound, growth factors and bioactive components activate tissue membranes and stimulate growth of new cells. The tissue is self-differentiating, meaning that it will stimulate new skin, bone, or muscle cells based on where it's applied. The all-in-one wound care bundle includes everything needed to perform these procedures, including the debridement tool, liquid allograft, membrane patch, and antimicrobial wound dressing. The first step is to utilize the debridement tool, which debrides the wound by removing any non-viable tissue and bioburden. The next step is to inject the liquid allograft in and around the area, placing some liquid topically on the surface of the wound, which will later be absorbed by the dual-layer membrane patch. The third step is cutting the dual-layer membrane patch to the appropriate size and shape, and hydrating the residual liquid allograft that is left topically on the wound. The doctor can also add sterile saline to fully hydrate if necessary. Finally, they'll apply the antimicrobial wound dressing to the wound. The dressing should be reapplied every 72 hours for 12 days and covered with a dry dressing. Amniotic membrane has a number of characteristics that make it especially suited to wound healing. The amniotic membrane contains a significant number of cytokines and essential growth factors. It reduces pain when applied to a wound. It increases and enhances the wound healing process, has antibacterial properties. It's non-immunogenic, it will not be seen as a foreign material. It provides a biological barrier. It provides a matrix for migration and proliferation of cells, and reduces inflammation and scar tissue formation. Billing for the procedure will see a reimbursement of $1,920 from Medicare for a wound 2 to 4 centimeters in size. Coding is with the Q codes that includes Q4128 and Q4142, priced at a square centimeter application, and it's coupled with a code such as C5271. The C code selected will depend on the size and location of the wound. Commercial insurance will also reimburse for the treatment. The cost for a dressing of that size is $700, leaving a profit of over $1,200 for the practice. For patients to qualify for the procedure on insurances, documented evidence must be charted over 4 weeks of a non-healing wound. Billing assistance is provided to ensure the physician fully collects on every aspect of the procedure and has the appropriate documentation. If you would like more information about this program, or if you're ready to add this valuable tool to your practice, talk to your Every Ancillary Practice consultant.